number of the branches will grow to 132, and we will have more than 1,000 services. The public service hall has built citizens' trust in government by making public services simple, transparent, and easy to access. It reduces bureaucracy and makes service delivery faster and more efficient. Also, customers receive services in one place. Decisions are still made by the responsible institutions, ensuring accountability. Every step of the process, from submitting an application to receiving a decision, is clear and transparent. In this regard, integrated public service delivery is key to make public service easier, faster, and more accessible for everyone. Instead of requiring customers to visit multiple institutions, navigate hard procedures, and spend a lot of time accessing services, the public service hall brought services together in one place through an under one window principle. At the same time, integrated services delivery is closely linked to inclusion and equality. In line with global development priorities, the public service hall strongly supports the UN Sustainable Development Goals 16 and 17, following the core principle of the 2030 agenda to leave no one behind. Physically, every branch is designed to meet the needs of people with disabilities, ensuring equal opportunities for all. We also reduce barriers caused by distance through the mobile public service hall launched in 2021. Through this initiative, specialized vehicles bring services directly to villages and remote communities. For example, the project has recently recognized as the European Public Sector Award, receiving a good practice certificate. Furthermore, the commitment of inclusion is also demonstrated by the establishment of public service hall areas in penitentiary institutions, introduced in 2023. This initiative helps imprisoned individuals to have equal access to the essential services supporting their rehabilitation and reintegration into society. In conclusion, the experience of the Public Service Hall of Georgia shows that integrated service delivery is a way to make public service easier, more inclusive, and more responsible to people's needs. By bringing services closer to citizens, simplifying access, and ensuring that vulnerable groups are not left behind. It helps build stronger institutions and better results for society. In this way, the Public Service Hall of Georgia acts as a bridge between society, citizens, business, and government institutions. Thank you very much for your attention. Thank you.
Thank you very much, Mr. Vakhtang, for the presentation, which captured the key milestone, and congratulations from 4 branches to over 132 branches. 27 right now, yes. This is a great achievement to see a case that has won such award around 14 years ago to continue and to continue to be a role model for us around the world. So we have a couple of minutes for Q&A, and I would like to invite the audience to ask any questions that you might have for our chairperson today. Yes? Could you please introduce yourself shortly and your question,
Hello,
please.
my name is Tamar Gulavam. Thank you for the information. It was very interesting. And I have one question. How do public service institutions ensure that rural and remote populations are not excluded from accessing services?
Okay, I think About this question, we have to speak first of all about mobile public service halls. We are using these mobile public service halls in the area where is not our branches. You know that we have some territory where which is far from the city center, so mobile vehicles where we can get the same services. I am talking about more than 500 services, and our citizens can get these services by these mobile public service halls. And also I can mention about mobile public service hall areas in penitentiary institutions. It's a Georgian project. I think there is no country which has same project in the world, and it means that prisoners can have access on the services which are in public service halls. So I think these two directions is the way which gives us that we can order services to everyone. I am talking about, first of all, I am talking about our citizens.
Thank you.
Thank you.
Thank you very much. So it's not just integration, but now the outreach that taking the idea that we go to the citizens, not demanding citizens to come to us, and also the prisoners population, which also is a vulnerable group that requires access to services. I see a hand in the back. Yes, sir.
My name is Michael Mutonga. I'm from Namibia. I work for the Public Service Commission. There has been a call by several administrations to put all systems together so that you can create something like a one window system. But the mind change. People want to stick to their own thing that they have started. What do you suggest we must do to make them understand that integrating systems will make better service delivery? I thank you.
Thank you very much. A very, very important question. Yes, how do you change mindsets?
I think when we are talking about Georgian model, the public service hall is the front. We are taking on the okay, applications. And decision maker is our back service. For example, Ministry of Internal Affairs, for example, I would say, for example, the Bureau of Registration and also other institutions. So there is no way to have some corruption in our country because we only have a chance to submit application only. It's very important. I think you have to choose this way and this direction because it's the best way for developing service delivery process in your country.
So that's very, very clear. The decision making still belongs to the respective ministries and agencies, but it's the front part that is only one, and it helps to curb corruption too because it separates the decision making and the application. Yes, yes. Excellent. So that's a great way to convince everyone to go towards this model. Yes. Are there other questions? Yes, please.
So first of all, it's really good to see all of you here. As a UN Public Service Forum 2026 members, it's a great chance to share our experiences. And as a public service hall chairman, it will be good for us to know your view about an AI. And my question is about artificial intelligence. So, what are your future plans in artificial intelligence, and more generally, how do you plan introducing it into service delivery systems?
Thank you. It's a very interesting question. I think the future of the service delivery process is connected with AI and modern technologies. We are planning to use AI in, first of all, in call center. You know that we have call center, one of the biggest call centers in our country. So we are planning to use AI in call center. First step will be using AI in chat, and also after that we will use it in AI in call center. After also we plan to develop the self-service areas in our public service halls, and it's very important for us because today we have more than 500 services, and tomorrow the number of services will be more than 1,000. So I think the developing of self-service area is our future. I'm talking about public service hall. So we want to use AI and robotics to develop these areas for our citizens. So future of the public service halls are AI and modern technologies also. Thank you.
Thank you very much for sharing us a very near future for the Georgian model. Do we have any more questions from the audience? Yes, please.
Thank you, sir. Excuse me, my glasses is because of my eyes. I'm Robert Folia from Spain. I work as a notary and represent the Spanish Council of Notaries. I thank you very much for your very smart and inspiring presentation. And I've got a short question for you. In this non-stop upgrading, digitizing, and modernizing aspect which is affecting and, how could I say, and developing each and every part of governments and administration and public service halls, not only in Europe, around the world. Is it envisaged to expand the digitalization to some other areas? I mean, for example, like today, you can buy a car online. Is it envisaged to expand it to some other areas, for example, real estate in the future? I mean, two citizens remotely connect to the internet and using a formula, a blank template, a sheet, they simply agree on buying and selling a house? Thank you.
Thank you for your question. Yes, it's true that Georgian model of the public service hall is the unique, and this is the project institution where you can get your passport in 20 minutes and ID card in 20 minutes also. You can register your business in 15 minutes, and I think this project is unique, and that's why we are talking that we can share our experience with you, and we can help everyone which wants to make such like our institution in his country. So when we are talking about digitalization of the process, the main part of our services are available online. More than 3,000 services. I can, how I know, you can get with Goji, my Goji. This is the site where you can get these services, and we are working. The Ministry of Justice is now actively works on this direction. We want to have these whole services online. This is our main aim. So I think we need about a year, and we will announce that we are a country who started this incredible project such as a public service hall, and we are the country who make these services online. Thank you.
Thank you. Thank you very much. Are there maybe perhaps one more question from the audience? Yes.
I come from Thailand. Yes. In Thailand, I want to share your idea, the changing point to the government to transparency. What is changing point your government use the digital transformation to resolve this problem?
Can you repeat your question?
I want to know the changing point your government use the digital to have the transparency in your government's public service. Thank you.
If you are talking about digitalization of our services, why we are doing this? Changing point. Okay, first of all, the main reason why we want to make our services to have online, the main reason is to simplify the services for our citizens. This is main reason. We know that the time is very important for us, and today time is very important. So if we make our services and made it online, it means that this time they can use in other jobs, make their jobs, and they don't need to come to public service halls and spend time there. We are talking about half an hour maybe, but this time is important for these persons also. And we are when we are talking about digitalization of our services, we have to mention business sector, and these services are very important for business also. So we have some projects for business, for example, public service hall have one innovative project for business. It is the business assistant, and every business has the assistant in the public service hall who is helping to deliver his business plans in service direction. So it's our future, and we will do our best for the same. Thank you.
Thank you very much. So truly putting citizens at the center, because you're thinking about their time and efficiency for everyone, including the business sector. So I think that was a great introduction to our session today. And we're here in Georgia, and for those who have signed up, we can get to see the public service hall tomorrow on site and learn more about this wonderful Georgian model that has been introduced to us. So please join me to give a round of applause to our presenter. Thank you. Thank you very much. So now, well, first of all, I forgot to introduce myself just now. in trying to make sure everything is on time, but my name is Aura, and I am from Thailand as well. I am the former director of the School of Public Policy at Chiang Mai University. So it's a great honor to be moderating the session today. I'd like to invite the speakers for the next session, one by one, to join me here on stage. First is Mr. Zaka Mirzayev, Chairperson, Board of the State of Social Protection Fund of Azerbaijan. Yes. And second is Mr. Ibrahim Al-Zolghaibi from Saudi Data and AI Authority, Kingdom of Saudi Arabia. And third is attorney Ms. Lisa Levardo Cruz, City Councilor, City of Cremona, Philippines. she's coming. And last but not least, Mr. Supachat Bundi Khan, the advisor of Pang Mu Sub-District Administrative Organization, Thailand. So, without putting anything in suspense, I mean, there's no secret now. These wonderful, distinguished speakers today will actually be presenting 4 of the 9 winning cases awards for the public service this year. So please join me in the round of applause, first of all. So it is a wonderful opportunity for us to hear from the winners firsthand and to get as much as possible this learning across. We all traveled far or close to come here, so it's best we try to learn from each other. So I've structured this interview style of panel to have 4 rounds, and we will go one by one. First of all, I'd like for each speaker to tell us in 1 minute what was your project about, if you don't mind, so that we have a general idea of all the 4 cases. Thank you.
Thank you very much, and good day to everyone. And I wish everybody successes and productive discussions in this workshop and further discussions in frame of this forum. So I am honored to represent the State Social Protection Fund of Azerbaijan here, the State Protection Fund of Azerbaijan. If I'd like to note that I will mention it briefly, SSPF. When I will mention SSPF, please note that it is the State Social Protection Fund of Azerbaijan, in order not to take more time. The SSPF is the authority of the Azerbaijani government's executive program with the broadest mandate in the sphere of the social protection service delivery to the population across the whole country. And it is responsible for a wide range of the social services, social protection services, such as, for example, labor pensions, assignment and payment of these pensions, and social allowances, state-targeted social assistance, as well as presidential stipends, and some types of compulsory personal insurances. At the State Protection Fund of Azerbaijan, our mission is very simple, but at the same time, it is very, very important. The importance is that every citizen should attain each social protection service in a timely, dignified, and transparent manner. And over the past 6 years, we have been implementing a comprehensive transformation of our social protection system to make it more inclusive, more accessible, more attainable, and transparent and efficient. And this transformation is reflected in our initiative that we have presented to the United Nations Special Committee for the Evaluation. And I am honored to see it, recognize it with the United Nations Public Service Award 2026. And this initiative has been launched in 2019 and is built on 3 interactive pillars. The first pillar is digitalization of all operations that is carried out by the State Social Protection Fund of Azerbaijan, SSPF. And we digitalize it not only operations, but also historic records, and as well as insurance experience. So the historical assigned labor pensions, social allowances, and all the archival documents. And subsequently, it helped us to deliver the services that we carry out proactively. When I say the proactively, it means that without needing an application, and submitting an application, without going anywhere, without visiting any office, without even visiting any online platforms. So when an individual is eligible, at the date of the entitlement of the social benefit right, it is it is automatically assigned. It is automatically assigned, but it means that sometimes, in many cases, in the beginning of our services, we started these transformation changes. Many of the people who benefited from our proactive services, they did not aware about the entitlement. They even knew that they even knew this entitlement eligibility when they received an SMS through the active mobile phone. And sometimes they visited to our offices, asked, what is this? What kind of application, what kind of social benefits I'm entitled? But nowadays, it is, I've already noted that 6 years have already passed and the population have already adapted these processes. And finally, this helped us to centralize our authorities' structural units. So at that time, when we started these services, the employment capacity of SSPF was more than 6,000. But nowadays, we have not more than 2,500 employees all over the country. So, please.
Yes, so we
Yes.
have a good understanding now of the social protection of Azerbaijan citizens. It's automatic, the eligibility. You don't, the burden to request for protection isn't on the citizens. The government gives you automatically once you're
Very
eligible.
excellent point that you mentioned, that we have shifted from the traditional model that
Yes.
the burden of requesting, burden of the eligibility was on the citizens, but we have shifted it to the system itself. So this is brief.
Thank you.
The brief introduction to our initiative.
Thank you. Thank you very much. May I now ask Mr. Ibrahim to share with us your initiative and who does it serve?
Absolutely. Very glad to be among all of you and looking forward to share a productive discussion on not just our initiative, but even to listen around and see how other initiatives amongst different countries have also developed their own progression into public service. The initiative is about two main components of the data value chain. It's the National Data Bank and Istishraf, both which are a national platforms for enabling data-driven government. Now, this initiative is not associated directly to the public because it is on the enablement side for decision makers and policy makers and government operations and developing their efficiencies. And the way this initiative is aimed to support decision makers in the country is National Data Bank is one component that is more towards the upstream of data collection, data hosting in a central hub from very different government agencies in the country that are responsible or associated with their different sectors in the country. And towards the downstream is, or the layer above this National Data Bank, is a Istishraf platform in which advanced data analytics are employed to utilize the available data from different government agencies that are collected in the central hub of the National Data Bank to support policymakers in policy design, policy evaluation, monitor changes proactively and be able to understand the assessment of the implications of these policies, develop better planning for resource allocation and public capacity. I think that's in brief. It's one component in the upstream, another component in the downstream to extract the value from the data that is available and hosted in the National Data Bank.
Thank you very much. So the initiative really shows the possibility of truly evidence-based decision-making through smartly using the existing data for making policies. And that's the highlight of our Saudi Arabia case. So now from the national level that we've heard from Azerbaijan and Saudi Arabia, let's move more to the local government side. Ms. Lisa, could you share with us what was your initiative and how and who does it serve?
Yes, thank you. Good afternoon, Aura. Good afternoon to the esteemed gentlemen on the panel. Good afternoon, everyone. First of all, I would like to thank the organizers for the recognition given to our city. With that, I would like to introduce Kaling Yakap. Kaling Yakap came from two Filipino terms, kalinga, which means to care, support, or protect, while yakap means to embrace. Together, Kaling Yakap brings the holistic framework for disability inclusive governance in the city of Carmona, Philippines. We integrated three core programs for this initiative. First is to give comprehensive assessment to disabled persons. Second is to promote responsive education and rehabilitation, after which we integrated our community-based integrated development program, and now we have recently launched our integrated shelter and support service. We give services to children, youth, and adults with disabilities together with their families and caregivers. The program seeks to look at persons with disability more than just mere recipients of social services, but instead are active participants in our local development and in our community life. That would be all from me, Aura.
Okay, thank you very much. So the initiative focuses on holistic, holistic services for persons of different abilities. Yes, and it's coming from the city level, the local government level, and it's becoming the model for other places as well.
Yes, it is, Aura.
Yes.
Thank you.
Wonderful. So let's move on to the case of Thailand, which is also a case at the local government level, implementing a national level policy, but more innovatively for a certain group of vulnerable people. What was your initiative and who does it serve? Mr. Supachat, please.
Okay. Good. Test. Good afternoon, everyone. I come from Thailand. If you had a chance to go to Thailand, Thailand is a beautiful country. But we come from the province named Mae Hong Son province. We near the border of Thai and Myanmar. The initiative we want to resolve is the problem about the children, stateless children. More than 500 people lives not have the document to declare who we are and who we go. So the administrative of the Thailand responsibility for the early childhood for 1 to 4 children age, but cannot receive the budget from the center government. So the problem issue we want to resolve is to make the equality to the stateless children and give the opportunity them to have the standard education in early childhood.
Thank you. Thank you very much. So the vulnerable group is not even Thai citizens,
Yes.
but non-Thai citizens who are living in Mae Hong Son province.
Yes,
And how can they access any services?
yes.
Yes. Okay, so we'll hear more about these initiatives by me asking the first round of question. What problem were you trying to solve? So perhaps each speaker could share, in Azerbaijan, citizens face bureaucracy, obviously. What were the actual problems that you were trying to overcome?
Indeed, in the previous part of the workshop, pointed out the problem that the burden was entirely on the citizenships. The first one, I'd like to point out that the first challenging that we wanted to solve to change, to shift this burden from the citizen to make the system citizen-oriented, citizen-centered, but the burden, responsibility should be on the system, should be on the government activities. So the core challenge was that the previous system placed the burden entirely on the citizens, but the modern, the nowadays system, it is absolutely different system that we should ensure that we must ensure that the citizen should not navigate complex procedures, administrative procedures, should not visit multiple offices, should not collect documents. And the services that we deliver as a governmental authority should reach their home, should reach their bank cards. But as I have already noted that today all social benefits that we assign, it is automatically reached to the banking cards of the citizens who are eligible at the date of the eligibility right. So previously, to access a social benefit, the individuals first had to be aware about the entitlement. And nowadays, as I have already pointed out, stressed out that this awareness is not required. And then collect supporting documents was also eliminated from the system itself. Regarding the awareness, I would like to point out that previously it was, many times happened that a citizen are eligible, for example, at the 5th of May to the pension, labor pension, but after 3 or 4 years, he's not aware about this eligibility. And now social benefits is appointed, is assigned to the population. That's why it is very challenging, especially for such segment of the population, for example, elderly people, remote rural residents, so the persons with disabilities, and etc. All the low-income families who are not so good in gain sort of good entitlement about this, enlightenment about this awareness. And that's why it was not, I'd like to stress out that these obstacles was not deliberately bureaucratic or artificial obstacles. It was just the requirements of the legislation, of the law. So that's why we can't mention that this was deliberately or this was bureaucratic activity as a result of the bureaucratic activity of the authority. It was not so. It was just the requirement of the government. And that's why we started to change this mind. First of all, to change it in the good governance manner. And we started to, first of all, to learn the needs of the population in order to make social protection services for them more accessible, as I already mentioned, that more attainable and transparent. And the process that relied heavily on manual verification at that time. And I'd like to point out that our objective was therefore clear, to remove unnecessary bureaucracy between citizens and their rights. And that's why the main, regarding your question, that the main issue that we wanted to eliminate, to solve, it was that to make the system more inclusive. So it is reflected in our initiative that we presented to the United Nations, inclusive and equal social protection services for all.
Thank you very much. So the idea that, again, we reiterate shifting the burden for eligibility to the system and therefore allowing citizens of all categories to have equal access. I think that is the key because it was unequal before, perhaps, and it was difficult to prove your eligibility with all the documents. Yes. So how about in Saudi Arabia, Mr. Ibrahim? What was the main problem that you were trying to solve?
It was mainly decision makers in the country, given the transformation that we had been having during the establishment and operation of the Vision 2030. A lot of questions different decision makers possess, either they have no direct answers or it takes a long time for this answer to be developed. And a root cause of this is having the data available in a way that can answer for such strategic or operational questions for decision makers. Now, government agencies historically have been going through a massive digital transformation in the past 2 decades or so. And they are way in the upstream of the data value chain because a lot of government services have been digitized and data is being captured, and it is very valuable when you look at it locally within that government agency or government entity. However, not having a full view, because if you think about government services, they're not just one local service to one government entity. They are very interconnected. And for us to develop a better understanding of how these services are interacted and the impact of one policy or one process or the efficiency of the operation that generally reflects on the public, we have to have a comprehensive view of all these data being captured at the government agencies and then being able to just at least profile or develop a profile of how something affects the public and then understand further what can be done and design for solutions more effectively. So mainly, this data, although be it valuable, it being locally hosted at these government entities limits the use or the usability of it to a certain local benefits. But if we think global benefits, this is why the National Data Bank was established in order for one central hub to host a copy of all of these data sets that is updated regularly and refreshed given the dynamics of these services, and the development of Istishraf, where advanced analytics and AI technologies are utilized to extract the value from this data. It's like mining, yes? Basically mining the data to support government entities and government decision makers in their policy design or policy assessment or in their understanding of their operation and how it interacts with the associated other government sectors for a better understanding and then translating into a better public service design.
Thank you very much. So really it shows a learning loop of policy learning, of not just having the data, but putting together all the data to try to capture the interconnectedness of every services and how we could make better decisions. And I like your word profiling, like modeling or doing some simulation of what if we change this, what if we add that, how would it affect the entire system? So that is something very remarkable because integrating government data, I think, is a challenge for many of our other countries. That's not Saudi Arabia. So let's move on to the Philippines. What was the main problem that you were trying to overcome?
Before Kalingiyakap, services available to persons with disabilities were often limited and difficult to access. mostly geographical and financial concerns. Geographical because institutions providing for education, healthcare services are often located outside the territorial jurisdiction of our city. And financially because most of these institutions, they're operated by private entities, making it very costly for persons with disability and their family. Second of all, there are very limited opportunities for employment and for skills development for these children, persons, adults, and youth alike. Also, based on our continued dialogue with the parents of these persons with disabilities, their main concern is what would become of their children in the event of their untimely death. Who will provide shelter and care for their children? These considerations are taken by the city and hence created a more coordinated, accessible, and sustainable support system for persons with disability in all aspects of life. Thank you.
Thank you. Thank you.
Bangkok. If you travel by the road you drive, you spend the time 3 days to this area. No plane, and sometimes no have internet connection. So we have 7 early childhoods in the responsibility of the local government. The budget is little, but we use the way to average the budget the center government give us to average to the state people because they paid only the children who have the civil status. The main problem we talk you about the background of this area. If you go to that, we travel 2 hours from the head of unit of the local government to the early childhood. And 50% of early childhood, the parents, the family not have approved the document from the center government. So they lack of the chance to give me the chance to the opportunity to the people to standard education. And we try to tell you that our side is the place of UNHCR refugee camp in Manson is here. In the refugee camp of UNHCR, in the last and the past, is the combat zone between the ethnic group and military, between the soldier of Myanmar and military force. So the problem we can solve in the past, if you want to give a change to the children, with notation from the stakeholder, the private sector, to give the change from the state people. But the changing point is I think the changing point in 1950. 1950. We proposed it, report this problem to the center government, the pain point we have, and they changed the policy. We talked to them, if you left the children behind you, in the future, you must to so many much of problem. For example, the drugs abuse, the family problem, the children labor, and another must be fixed in the future. The changing point is we promote to the national security problem. The center government changed the way to register them to the G code system. The G code system is the code to classify the children who not the state led, not the who have no the document. And you, if you promote this group of the children, you can approve by the head of the villager. The first, your parents must have the permanent job in Thailand the first. And the another way that we obtain the data, we collect the data from the smart kit, and we confirm and collaborating with the people in the village to approve them and achieve them in the education.
Thank you very much. So we were able, well, I mean, the case in Thailand, you were able to put the education right up front, and then
Yes.
all other rights could come
Yes.
regardless of the identity of
Yes.
the child.
Yes.
Yes. Um, so that was the problem you mentioned in the beginning was budget.
Yes, the
Because
budget
like any other
and the data.
government, governments subsidize based on the citizens
Citizen,
served
nationality.
nationality.
Yes.
How do we go about in this case, because these are non-ties?
Yes,
So
non-tie.
that is the initiative that you were able to overcome
Yes.
this barrier, right? So we will be hearing more of how you did that. Let me start with the second round, and I think this is where all of us we now understand the cases thoroughly. Now we want to know the practicality of how you actually achieve this. Okay, so we'll start with Azerbaijan. How did you make sure the elderly people, the rural citizens, the low-income families, and persons with disabilities could benefit? Yes, you said it's automatic, but what if they don't have the phone? What if they're still difficult to read and understand? What if they don't have a bank account to receive social services, social protection? Were there any special strategies that you had to make very inclusive
Thank you
policies?
very much. It is very
Yeah.
interesting, and I would say that it is a very interesting question, but crucial point in the effectiveness of the service that we deliver throughout the country. And when we started in 2019 this initiative, the first times such kind of problems we emerged, not really, but in every step we encounter such kind of problem that we, in the offices, our state as a state social protection fund, we support that we have already entitled that person or this person with the, for example, social allowance service, but after 2-3 months later, we saw that this bank card that we have already offered to the bank account, to the offered, has not been taken by the individual, by the citizen that is entitled to this. And at that time, we didn't stop this initiative. We started enlightenment processes, the digital literacy processes. And I'd say that in Azerbaijan, more than 80% of the population are the active users of internet. More than 80% of the families. So only in remote rural residents we do have such kind of problems, but we started to go there with our service centers, with our mobile service centers, and I said that we have another under the Minister of Labor and Social Protection of Azerbaijan, we do have the agency, special agency. It is called a DOST. DOST means in Azerbaijani it is friend.
Friend.
But it is the abbreviation of this DOST. It is sustainable operational state services, yes. Social security services, yes. And this, it is, the DOS centers is our front offices. And in these front offices, in rural areas, in the center of the Azerbaijan, in the main cities of the country, with these DOS centers, we can reach such kind of segments of the population that in order to develop their digital literacy. And at the same time, we recognize that quality of the service, including the timely access to social services, depends not only the platform, the digital platform that we already developed, deployed. It also depends on the public awareness. And that's why the question that you pointed out, that is very actual for us. It's very actual through the national outreach, as I already mentioned it, and through the digital literacy, we have already attained very effective results. I'd like to point out some figures. For example, in total, just last year, the last year of this initiative, 2025, 258,000 proactive services we provided. So in compare, I'd say that in Azerbaijan, the population of Azerbaijan is 10.3 million. And State Social Protection Fund of Azerbaijan in monthly basis deliver social benefit services in monthly basis 2.2 million people. So 1/5 of the population. So just 1 year, social benefit assignments in this figure more than 158,000 proactive assignments. It is a very huge number for, in this direction. And I would say that just as importantly, we design it, the system together with the people who use it. And starting from the 2019, we started to test our initiative, our digital platforms. And the result demonstrated the impact of this approach. Today, the platform serves more than 1.8 million active users. So while 18 types of social benefits are assigned automatically, so proactively. And that's why I'd say that the vulnerable segment of the population, such as elderly people, persons with disabilities, remote rural residents, as well as the low-income population, nowadays their attitude to the quality of our services is more than 98%. So the more than 98% of the population who receive these services are satisfied with SSPF's services. We obtain these figures through our digital platforms as well as the automated, so digital survey terminals that we have installed in our service centers.
Thank you. Thank you very much. So the service is extended to alignment. I like that word. And seeing where the services are provided but not used, and going along with other agencies that do digital literacy to fill in the gaps where some people might still be needing more help. So that's a very, again, to me, it's a policy learning loop, and it's really closing in on really to leave no one behind. And it's very detailed work, let's put it that way, right? So it's not just integration and then, yes, we're done, but always learning and following the citizens, whether they're getting the service
Yes,
truly.
right. I'd like to add one more thing, that in this initiative, the political will of the government is in the center of this
Yes.
initiative, because without the political will to change, to transform the system itself, as we have already mentioned, that to take the burden from the citizen and to pass it to the system itself, it is according to the presidential decree, the orders of the head of the state of Azerbaijan. It was in October in 2018 that the president of Azerbaijan ordered with his own decree that every social protection system should be reached the population without any burden on them, on the electronic ways, automated, on proactive ways. And we started from that time, and we attained such a good results that we are presenting hereby in our initiative.
Absolutely an ideal initiative. The political will, the presidential decree, a one-pager. That's all we need to design the rest, right? Yes. So now let's hear from Mr. Ibrahim in Saudi Arabia. How does your data system help government agencies make better decisions for people and not just improve internal efficiency. I mean, tell us the details of who's doing the analytics and how are you engaging the citizens to even come up with the questions to use the data? Because I think that's the key, right? What questions do we ask to use the existing data to answer? Please.
Thank you. Now, every government agency has put a plan towards not just their general operation or business as usual, but also to achieve certain objectives in regards to what is expected of every sector. And I will maybe pull some examples to highlight how this integrates and works. Now, this initiative has no value if there is no adoption from the associated government entities and policymakers who actually design and evaluate and do corrective measures and interventions in association with the outcomes of what the data is telling us. Because regardless of what can be developed, if the adoption is not there and if the understanding is not there, hence this data is valuable, but it was not utilized fully. And the way this works, maybe I'll bring one example of working with Ministry of Human Resources and Ministry of Education, for example, and other associated entities. Now, these two different sectors have local objectives towards better education, better qualifications in the market, and this goes on. The Ministry of Human Resources have objectives in regards to better job accessibility, less unemployment rate, more job opportunities, and so on. Now, one important thing of combining and having a central hub for different data sets that are generated by different government services in regards to employment records, education records, public education outcomes and public education graduates, and their specialties and the demographic profile of those, is first just combining those gives us an understanding of directly where are the gaps in the labor market, or where are the gaps in the education system. Because what you would want this to be an objective for the labor market design and the education design is for individuals who have gone through their education to find the associated and the proper job opportunities in the market. And what this gives us is a first understanding of a comprehensive picture of where the gaps are, whom are the most vulnerable groups that were unfortunate to find jobs, what are the associated dimensions with these, whether they're demographic dimensions, regional dimensions, and different market dynamics in regards to the associated sectors. This information, or these information pieces by their own, are key in multiple public streams. One of which is designing for upskilling initiatives. If the problem is somewhat not captured by the education sort of public service. Another would be designing or redesigning capacity planning for the public education to be more associated with what the market needs and the demand. And this entails a better understanding of supply and demand in the labor market, and hence design for success in terms of better unemployment rate. And this also drives directly to not pushing or not having a lot of families or individuals who have to eventually be pulled within poverty, be pulled within social protection, and so on. What are the root causes of having these individuals have sustainable jobs and hence sustainable income and better quality of life? That's one aspect of how the interaction model works. And what is the role of the analysis or the SADAIA within this and how it interacts with these government entities, because all of this is an enablement initiative for these government entities to actually take that in and move forward in their planning and monitoring and policy design. Another example is just shortly, just to also give a different flavor of different sectors that are covered within this initiative, is traffic accidents, death rates, and injuries and whatnot. And there is a ministerial committee in the kingdom who's formed formed by different associated government agencies that are involved in the traffic safety, including traffic department, including Ministry of Interior, including Ministry of Health and whatnot. And this ministerial committee is, the main objective for this committee is to lower death rates that will reflect on the life expectancy of visitors and residents in the kingdom. And for us to be part of this committee is enabling these sectors, health, traffic department, to first understand what is happening, where are the traffic accidents, what's the 20% of these traffic accidents which are causing 80% of the implications and deaths and injuries. What are the root causes of these accidents? How does it take for, how long does it take for the associated government agencies to actually take in and develop for better services in terms of whether ambulance planning, capacity, resources allocation, because sometimes it's a problem of just reallocating resources. Sometimes it's a problem of not understanding where the focus should be. And bringing these data together, whether from health, whether from traffic department, and exposing that information and intelligence to the decision maker and to the committee, with all government entities who are part of this, adopting to these outcomes and taking action and feeding back this loop. This is how it reflects better on the public service and the public in general.
Thank you very much. So the focus on decision makers, I think, is the key here, and how what you explain to me is outcome-based systems thinking, and this is how we can break the silos, right? What are the actual outcomes we want to achieve? Thank you very much for sharing the cases, education, labor, and deaths related to traffic and health and other sources. So these can only be done through the integration of data and the ability to have, I call it intelligence governance, better analytics. So let's now move on to the cases from the Philippines and Thailand. Your cases or your initiatives help the most vulnerable groups of our society. Can you share what strategies were most effective in identifying the vulnerable groups? How could you build, the trust when working with them? And did you use any digital tools in any way? If you could share that, thank you.
For our initiative, the Kalingyakap, it's actually a combination of a lot of the tools that we use. First, we make use of our disability assessment. We have household profiling. We also made use of a system similar to the one being discussed by our friend from Saudi. Of course, this one is on a local level. And we called it Registry of Barangay Inhabitants and Community-Based Monitoring System. For learners, if we assess that a person with disability, for example, a deaf mute, needed to go to an institution, we have to assess their progress. How are they reacting to the program that are given them? For those who are undergoing rehabilitation, we have to track their progress. For learners, if they are already done with the program, we could assess if they're ready to be integrated to the normal education system. For our community-based programs, we track the healthcare services that we have to give them. For example, administration of vaccines and the like. For employment, we also monitor their job placement. We even enacted ordinances that require business establishments that are being organized within the territorial jurisdiction of our city to employ persons with disability who are qualified for the jobs available for their industries. For social services, we also make use that they are recipients of social services like birthday cash gifts and the funding for the different organizations that they have, because there are organizations that create tofu. Some use recyclable materials and create like clocks and coin banks and then resell it to the community. So these are the funding resources being provided by the local government to the different persons with disabilities organizations that we have. And the data that we use from all of the systems that I just mentioned earlier, we use it to be able to assess the different needs at an earlier stage of, so it happens is an enumerator goes to the household, they assess the family, and if they detected that there is a need for, if there is in any eventuality a person with disability in a certain household, they would come into the program where a tailored fit program will be given to them, and they will undergo this program. And once they already progress and graduated from it, they will be ready for employment afterwards. So it is like education, assessment, and employment to make it sustainable for our persons with disability. And it enables the government to make good use of our resources effectively and be able to craft a program that is truly fitted for the person's circumstances and not just in a general vague view of the program in itself.
Thank you very much. Sounds like a very highly customized, compassionate service to the citizens of your city. Yes. Yes. Could you share about Thailand?
About Thailand, we have the two strategy to solve the problem. The one is the technology from the digital technology. And another one is collaborating with the villager and the other organization in this area. The first, I introduce you to the Smart Kit system. The Smart Kit system is the digital platform we, using myself to develop them on the freeware. If you know the Google App Sheet, you can do something like this. On the start of the innovation, we send the drone and to acquiring the data from the GIS spatial. And when we have the photographer from the aerial photo, we try to link the data to the registration database of the Thai government. But we found that more than 60% of the data cannot be linked because the household you see in the aerial photo not have the household number. So the next, we fill in the operation, this by the field survey to collaborate with the head of the villager and the people around the family and the parents. We go with the questionnaire and Smart Kit to ask him, where are you, where you come from, and approve them to the G-code system. This is the method we do. I think some information, we will fill the operation and we think the part of the model. The very important is the good data, initial data, to make the trust to the center government, to make the trust to the parents of people. You have a change to change my life, change your life, and support them to have the high quality of life in this area.
Thank you. Thank you very much. I think the two cases really demonstrate hands-on, compassionate, on-site visits and truly learning, as well as longer-term outcome focused, not just that year service, but the education, the employment, the dignity of the citizens. And so the digital tools become a tool. It doesn't lead the way. It's about the services that leads the way. So thank you very much for sharing. All 4 cases, extraordinary. We have some time. Would anyone in the audience like to ask questions to our award-winning initiatives today? Yes, sir? Yes, in the back?
I've got 2 questions. My colleagues on the right-hand side. The rest I will exchange cards with them because I'm interested in their project as well. The first one is about the people, what is the people with
Persons with
disability.
disabilities.
Yeah. Now, what I hear, you are a local authority entity. And I heard you saying you do share with central government and other entities to apply the same methodology. Are you satisfied that they will be able to perform exactly like what you are doing? Because I'm worried that if they don't do that, then you'll attract a lot of people from other local authorities. Then it's going to give you a lot of trouble. What are you going to do about it, and what are you doing to prevent it from happening? For my colleague from Thailand, we have exactly the same problem in Namibia, whereby the children from Angola, because of their condition of living, they come into Namibia and they flood all the cities. And it affects tourism. Tourists don't come anymore to Namibia. We have tried to take them back, but the following day they come back as well. But I've heard your initiative, which is perfectly right. But my main worry is the people. Ordinary people don't understand. They are pushing the government to take these children to go out. What is your relationship with the citizen in that local authority? How do you make them understand that we are solving a problem? And are you not encouraging more children from your neighbors to come in because they are living a good life? What is your negotiation strategy with the country on the other side? I thank you.
Thank you. Thank you very much for your 2 questions. Yes, Ms. Lisa. Ms. Lisa, perhaps you could also, conclude with how do you scale up if you want to scale up the national level.
I would like to thank the gentleman from Namibia for your question, because actually that is now our growing concern. Because before, when we started the program, we only have 20 learners occupying 1 classroom. Now it has bloated up to 4,000 learners already, precisely because, like our shelter program, it's the very first in the country. And like you mentioned, it attracted families having persons with disabilities in their household to transfer, and that's actually what happened. They transferred residents, and now it's bloated up. And what we do now is to be able to restrict the depleting resources of the government, the city government at that. So we try to impose restrictions. They have to be residents of our city, which means they have to stay within the territorial jurisdiction of the city for at least 6 months before they will be considered for the program, because it has really magnified. When we started the program, we only envisioned, because of the profiling, we only were able to identify a few of them, but now it has blown out of proportion. But I think our blessing comes from having a very good, like our friend from Azerbaijan said, we have a very good political will. We are blessed with political leaders who have that vision to incorporate the persons with disability in the core local governance structure. And the successor of that vision actually embraced an all-inclusive policy in her governance, wherein no one should be left behind. So with all the compassion that she carried with her, she integrated this system, so much so that an independent department, which we called Persons with Disability Affairs Office, was enacted through legislative framework. So it is also very important, apart from political will, that we have a very good legal framework that institutionalizes the program. After which, you have to have a very good set of people who really have compassion and dedication to bring about the program. Because as has been overemphasized this morning in the opening program by the Minister of Justice of Georgia, that it's important for a program to succeed that we have to gain the trust of the people we serve. And trust, as we all know, it's very hard to get by. It takes years. The government has to convince the people that you're willing to listen, that you're able to address their concerns. But the good thing there is, once the people see that you are true to your initiative, a lot of collaborations will happen. Now we have strong partnerships with other government agencies. We have donors, we have private institutions supporting the program. We have community and civil society organizations coming in. And this enable us to expand our resources and sustain our program.
Thank you very much, Ms. Lisa and Kun Supachat.
Okay, I want to share the idea. I think you know the idea is easy, but the implement is too hard. In our project, in the first of start, we have many barriers. The language difference from the highland people, from the local governments. But the same thing if you want to apply to your country. You want to found the people, them trust around the family, and the local staff is the main point, collaborating and sharing the data. I think this idea. I use the 40. Yes, the first we must to tell them the purpose. If you are clearly of the purpose, you tell them 1 time, 2 time, 3 times, maybe 10 times. And you must tell them the truth. If you tell them the truth, they trust them. They give me the trust to you again. And you can teach them how to make the quality of life. Teach them and train them to have a good job. If the children, you change the future of the children, you change the children right forever from this innovation.
Thank you. So 4 T's, tell the truth,
Yes, tell the truth, and teach them,
teach them,
and train them.
train,
Yes, and you will come back the truth.
trust. Truth and trust.
Yes, truth and trust.
Yes,
Yes.
for long-term collaboration. We shall remember that.
Yes.
Yes. Trust in the result of the truth.
Yes.
Yes.
I think so.
Trust in the process. Right. I think, 10 minutes of each speaker, but actually it's a decade more of actual work that required different teams, different political wills, different testing, different learning. Until today, it doesn't do justice to say. However, there are so much challenges. I'm sure that all of the initiatives have went through, and your learning will continue after this award. Just like our friend from Georgia, who 14 years later comes back to continue to share the journey. So if you could help us wrap up by maybe saying one sentence of lesson learned that you would like to share with the participants today, what would you say? One sentence each, please.
Summarize just one sentence, I would like to not last the point that we have discussed, that the technology provides for us the capability, but the trust gave us the legitimacy.
Okay, thank you. Trust gives legitimacy. Mr. Ibrahim?
I would wrap up by putting data quality is essential, and adoption of decision makers is also more essential, because with that, data quality will be exposed and that will be fixed, and then the wheel will go on.
Thank you very much. Data quality and the quality of decision making by our decision makers. Ms. Lisa?
I think for us, it's trust. Trust builds community, and community is empowered. Once community is empowered, then community is better built.
Thank you.
The most lesson we learned about this service, I think the best idea you think from your head, the first, the best, if but you want to delegate the success to them, you don't think maybe you just trying, but you do it with your heart
Your heart.
and collaborating the people is your hand.
Yes. So your head, thinking, your heart, compassion, collaborate with your hand. Wonderful. So we have had the chance to heard from our award-winning initiatives, and I'm sure that everyone in the audience would like to learn more from you. So we'll have more time through the gala dinner and all the coffee breaks that you can approach our speakers. And I think this is a good chance now for us to give a very, very loud applause to our award initiatives.